We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
I'm Geoff Fary. I'm from Australia, and I've been asked to speak to you this afternoon about prevention. What is it, where is it, and what can we do? And perhaps what lessons can be learned from the experiences that we've had in Australia. Throughout, I've always kept at the forefront of my mind that we're not dealing with cold, hard statistics here, but we are dealing with real people and the effects that this insidious disease has on real people and their loved ones. What I would like to do, if the technology will work for us, is show you a very brief film excerpt of one of those real people. So I'm told if I click on this, something will happen.
There is no safe level of exposure to asbestos fibres. Are you asbestos-wise? For information and support, go to asbestoswise.com.au.
The person that you saw in that film excerpt is Lyle Watts. Lyle was very influential in the development of the policy and strategy that's been adopted in Australia. Lyle was a very courageous campaigner for reform in this area and was, of course, himself a sufferer from lethal mesothelioma. Lyle died 2 days short of what he'd hoped to be his first attendance at the Australian International Asbestos Awareness and Management Conference. And it's people like Lyle, the thousands, the hundreds of thousands like him around the world, that we believe that we need to keep in mind when we're dealing with this most challenging and pernicious of problems. Many of the transparencies, the slides that I will show you, will replicate material that you've already seen, so I'm not going to belabour them in the interest of time. We know that the incidence of asbestos disease and death in Australia is rising and continues to rise. What we also know, interestingly, is that every time there's been a peak predicted, that the year that that peak's going to take place has been pushed out a little bit, so it keeps moving out and out and out as more and more people contract the diseases. You've heard already today from other speakers about the World Health Organisation statistics, as shocking as they are. You know that the World Health Organisation has stated that there are no minimum safe exposure levels to asbestos, and all forms of asbestos, including chrysotile, are potentially lethal. And it was against that background that a couple of years ago I spoke to this conference and talked about a report that the Australian government had commissioned, the Asbestos Management Review, which basically the aim of which was to come up with a series of recommendations for the Australian government as to how we dealt with the lethal legacy of many decades of asbestos use and asbestos contamination in Australia. When I last addressed the ADAO, I've got to get the sequence of those initials right, the ADAO conference in 2013, I was able to report that the recommendations were that day being considered in legislation that had been handed down in the Australian Parliament. I'm happy to now report that the Australian Parliament unanimously carried, all parties supported, the legislation that arose out of the 12 key recommendations that were presented to them in the report of the Asbestos Management Review, one of which was the establishment of what we believe is a world first, an independent agency which is designed to coordinate and implement a national strategic plan dealing with asbestos awareness, asbestos management, and ultimately the objective of the eradication of the man-made asbestos diseases from Australia. What is on the slide which is before you at the moment is a brief timeline of what transpired. The legislation was passed and received assent on the 1st of July 2013. A new agency was established. A tripartite advisory council was appointed to advise both the Australian government and that agency on its operations. And since that time, and since I last spoke to you, there's been a change of government in Australia, and the new government in Australia has maintained its support for the operations of that agency, and importantly, its funding for the operation of that agency. And despite some attempts to wind back its independence, the independence of the operations of that agency, and we believe that it's particularly important that that continues into the future. What are the key functions of the agency? Well, it's not a regulatory agency, it's a coordinating agency. In Australia, the responsibility for regulation of matters relating to the safe handling, management, transport, disposal and storage of asbestos reside with our individual state governments. But there were different approaches being taken in different areas, and one of the functions of this agency is to coordinate that, pull that together and to have a standardised approach. It is to provide advice both to the Australian government and to stakeholders on safe methods of handling and dealing with asbestos, to liaise with all of the various governments and agencies and stakeholders in Australia, and to commission research to determine what is the world's best available practices and procedures, and to monitor that research and to inform further developments in Australia. One of our first priorities was the development of a national strategic plan with an initial period of operation of 5 years. It was developed, and this is critically important, it was developed in conjunction with all interested stakeholders: state government, local government, labour unions, employers, medical experts, support groups and the like, all made input to the development of that plan. It's intended to be implemented in conjunction with the operations of all of the governments, and in a very rare development in our system of government, and I'm not sure how it works in the United States, but we've actually now had sign-off not just by the national government, but by each and every state government in Australia have signed on to that particular national strategic plan. And again, that's something of a breakthrough and something of a first for us. It's not intended that that plan duplicate the work that individual states and territories are doing in Australia. Rather, it's intended to coordinate it and pull it together. This is a fairly busy slide. I don't intend to step you through all of the details of it. Suffice it to say that it covers the areas of management, transport, awareness, coordination, infrastructure and the like. But in particular, and you probably can't read it because of the smallness of the type, but on the column on the far right-hand side of that slide talks about international developments. And what informs that is a belief that we have in Australia is that we will only effectively combat asbestos-related disease and asbestos-related death when we ultimately achieve a total worldwide ban on the mining, process, export and trade of this pernicious substance. And to that end, it is part of our national strategic plan that the Australian government and Australia will play its role in actively campaigning for such an outcome. And in a moment, before I conclude, I'll talk just a little bit more about that. But before I do that, let me talk about, and it's very early days in the life of the Asbestos Safety and Eradication Agency of Australia, what its early work has been. Obviously, it's been on development of the National Strategic Plan, which has now been signed off on. Awareness is critically important. particularly for the third wave of people who are being exposed to airborne asbestos fibres, to make people aware of where asbestos may exist in the home and elsewhere. I notice there's a typo on that slide. It says DIY. That's meant to mean do it yourself, DIY, DIY home renovation and the like, for people to recognise where asbestos may be and where to go to get assistance and professional help and advice if they do encounter it. We're focusing on areas such as the safe disposal and transport of asbestos-containing materials, including the illegal dumping of asbestos-containing materials, which has been widespread throughout many parts of our country. Talking about bringing about a standardisation or a harmonisation of the different standards and policies and procedures that apply. In our country, if you encounter asbestos, the case was that it would often depend not only on what state of Australia you lived in, but on what municipality you lived in as to what advice you got, which is a nonsense. You really need to have the same advice given to you regardless of which part of Australia you live in, or indeed whatever country you might be in. We've undertaken a survey to establish amongst tradespeople what their baseline level of awareness of the dangers of asbestos are and where they might encounter it in the work that they undertake from day to day. And the reason that we've undertaken that survey is to determine the gaps where there will need to be more effective training methods and activities put in place. We are looking at a number of pilot programs, and one of those pilot programs in particular, for those of you who might be aware of Australia and its history, is many parts of Australia are very remote, and in many of those remote parts of Australia there are settlements of our original Indigenous or Aboriginal Australians. Quite often the buildings which exist in those communities are made of asbestos-containing materials, and quite often, because of their age, they're in a bad state of repair. Another chronic problem which affects those communities is intergenerational unemployment amongst the residents themselves. So a pilot that we're working on at the very moment is for those young Indigenous people who want to volunteer to do so, to equip them with the skills that they need and the training that they need to be able to, in a licensed way, safely remove, transport and dispose of that asbestos-containing material. In the process, start by cleaning up their own communities, but also in the process obtain job skills for life, given the sheer volume of the challenge that we have in the asbestos clean-up in Australia. And of course, we hosted for the first time in Australia a National Asbestos Awareness and Management Conference in November of last year in my home city of Melbourne. The fact that it was in my home city of Melbourne, I assure you, was a pure coincidence, but it was in Melbourne, and we were delighted that Linda and a number of other people associated with the ADAO were able to present and make a big impact at that conference, and that sort of international conference is very valuable. What can we do in the couple of minutes that are remaining to me? We really need to talk about an effective, we believe, worldwide ban. There will be a meeting taking place in Geneva in a few weeks' time, and one of the things that that meeting is looking at doing is having a proposition co-sponsored by Australia to have chrysotile asbestos added to Schedule 3 of the Rotterdam Convention. The effect of that would be that chrysotile asbestos, along with the other forms of asbestos, would be listed as a worldwide known carcinogen. Now, we've tried this before. We would like to think that we would be successful in Geneva this time, but we're also aware that there will be quite a strident campaign of opposition and veto mounted to that by the asbestos-producing companies. We need to be aware of that, and as members of the international community, I think we need to call those countries and those manufacturers on what they're doing. It is a scientific nonsense to argue that chrysotile is not a carcinogen. We need to be naming it for what it is, and for those people who are exercising their right of veto, we need to be naming and shaming them, and I hope that all of the participants and stakeholders in this conference will join in that effort, which will take place in Geneva in a few weeks. Let me conclude just on this point. It is critically important to be able to impact the attitudes of our politicians and our decision makers. And let me give you some information for free. They don't always act on the basis of the power of the logic of your argument. They will, however, always act on what their perceptions are of community expectations, what the community upon who they rely to be re-elected want them to do. That's why it's very important for all of our organisations to be able to reach out and cooperate not only with one another, but to form alliances with other like-minded organisations in the community to get third-party endorsement and to reinforce to our politicians and decision makers the need to move and the need to move urgently. And nothing is more powerful in all of that, and it's been resonating through the conference today and will continue to do so, I'm sure, today and tomorrow, but the voice of the victims and their families. Thank you for listening to me. I look forward to the rest of the conference.